ADHD is one of the most common neurobehavioral disorders in childhood, and often medication is part of the treatment. What are the possible side effects of those prescription drugs, and is there a safe, natural alternative? Here with more is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine. Boy, this is a big subject.
Yeah, it's back to school, and this is a huge topic for parents.
Absolutely. A lot of kids today, a lot of parents know they've got their kid on some sort of prescription drug to help with ADHD or ADD, and you're here today to say there's other alternatives.
Yeah, millions of kids are now taking each of about 6 different ADHD drugs. They keep making newer, different ones, trying to make some with fewer side effects, but they all have horrible side effects, and most parents are concerned about those side effects and worried about them. They've heard about some, and they're often feeling pressure from a teacher to get their kids on these, and they don't know, is it just a normal, little boy? Is it really hyperactivity? What's going on?
Right. So what is causing? I mean, you do hear more and more about it than we ever did before.
Well, it used to be thought of as just a little boy's disease. Now it's almost equal, little boys and little girls. And in one class of 30 kids, there'll be at least 10 kids on ADHD drugs.
Right.
Oftentimes. And the drug companies are pushing this to parents and marketing it, so a lot more parents are, I think, giving it to their children. It's becoming kind of more socially acceptable, so I think that's increasing the numbers. But stress is also increasing in our lifestyle, and our kids feel this. Our kids feel our pressure and stresses and the fast pace of life, and it really burns through those neural hormones that keep them calm, and that's where we really got to focus on.
And that's what you were talking about. They have their different levels of some of the things I can't repeat that you mentioned.
Yeah, the brain makes neurohormones, dopamine, norepinephrine, and epinephrine, that increase alertness, acuity, happiness, excitement. Too much of that causes anxiety. Too little of it causes poor focus, poor attention, kind of blasé, flat emotions. Then we have serotonin and GABA, which are neurohormones that actually calm the nervous system, help you get a good night's sleep, help you feel joy and happiness, turn off the runaway thoughts. And so all of those play together, and the drugs usually only address one of those. And so it pushes the body in one direction. So most of our drugs, I think we've got some slides to show the side effects. These drugs are amphetamines. Ritalin is what we call a methylphenidate, which is very similar to Adderall, which is a frank amphetamine. And Concerta, a little different, it stimulates norepinephrine. That is the body's own natural excitatory neurohormone. But the potential side effects, you take this and you get anxious. How does that work? Somebody's got hyperactivity and you give them anxiety, that seems to make it worse. Of course, they lose weight, it's anorexic, it's like being on speed, and they get aggressive. And death is actually a potential side effect. We now have seen a study that shows that kids are 5 times more likely to die of sudden death syndrome than kids who are not on these drugs. So it really creates heart attacks and strokes in these young kids, and I think it's even underreported because it's so hard to prove that that's what caused it, but serious side effects. And then Silert, Strattera, and Intuniv are kind of more recent ones. Silert is causing Tourette's syndrome, kind of jittery and these verbal tics and uncontrol of the body, but liver failure and death. And Strattera has also been shown to cause liver failure and deaths. Chest pains, nausea. Strattera is supposed to be a non-stimulatory, but it is in a different way. They're all stimulating in one way or another, and they really stimulate by, it's like an emotional straitjacket. It ramps them up so much, then they're tight.
We talked and mentioned maybe your teacher was telling you that, hey, I've noticed Johnny or Susie acting, hyper or not focusing. How do you know if you seriously have an actual problem? How do you get tested, or how do you test your child?
Well, the only real test is a subjective assessment.
Okay.
So a doctor will fill out a questionnaire, have the patient or the parent kind of go through the symptoms, the blurting out in class, the disruptiveness, the getting up, the hyperactivity. So there's ADHD, which can be either hyperactive or just inattentive. And sometimes it's a mix of both. So you go through the symptoms, and if they've had it for longer than 6 months, and if it started before age 7, then that's a likelihood, and they just typically prescribe some ADHD drug.
Right, but you do a urine test?
We say test those neurotransmitters. Why don't doctors actually test these and find out what the actual level is, and then balance all of them rather than just push it? So we're seeing now patients who've been taking these for 15 years are now 30. They started at age 15 or even younger at age 7 in first grade, and they're saying, yeah, they got a 4.0 grade point average, They were controlled, they were hyper-focused. When they took it, it was like, boom, they went from inattentive to now hyper-focused, and they got their dream Wall Street job, and now they say, one of these patients, it ruined her life. She said she's no longer happy, she can have no relationship, she can't focus to have any kind of romantic, deep, long-term relationship, she doesn't speak to her family.
So they're seeing side
anxiety,
effects years later.
Insomnia. Yeah, years later, so they don't go away.
So for folks who either have their kids on it or considering it, what do you recommend them? What are these natural products that you can try?
Here's what we do. So for example, in a recent patient in my practice came in May, 10-year-old who'd been on Adderall for 9 months. He tried Strattera first, and that didn't seem to work, so they put him on Adderall, which is the amphetamine.
Which is typical. They try all the different drugs, so they find one that works.
And that seemed to work great. He was able to stay focused, sit in class, pay attention, not blurt out. But then about 9 months later, he started developing tics. And these little kids can't tell you they're feeling anxious and they're not sleeping. They're laying wide awake at night, and they start having these verbal tics and eye twitches and head rolls and grunting and machine gun noises this little boy was making. And he can't control it, and all his kids are in class are looking around, what's wrong with you?
Right.
So what we do is we have a product called Acuity that has a combination of kava, which is a plant from Fiji, the Polynesian islands, that calms the nervous system, actually tones down that excessive norepinephrine and the body's own overactivity so they can focus, and yet it increases mental clarity, mental acuity. And in there we also have grapeseed extract, which helps with allergies. A lot of times we find that brain allergies, foods, are actually irritating the brain and causing some of these neurotransmitter imbalances. So we test for food allergies, we test the neurohormones, and then we use a product like this called Acuity, and then we use Tranquil Clarity for adults that are, or children that are over 12, which is a higher concentration of the kava, and it also has ginseng in there and bupleurum, which helps to calm down the nervous system but increase that acuity.
You know, for parents who are listening or watching, or, you know, I've been having my second thoughts about what I'm doing, this is a great way to go through the extra effort, get the kids tested, see what other options are available. And you're having a special offer because people, parents, you know, maybe they're not happy with what they're seeing and they want to do something.
A lot of parents come to me because they're already on these drugs, but you ought to start before if you're thinking about it. But if you're on it, it's not too late. Like this little boy, 5 months later, he's off Adderall, no tics, he's focused in class, he's great on just the natural products. He uses this one, and we also use 5-HTP, which is the serotonin in his case, and he had food allergies. And now we find out if he still goes back to any of those foods, he gets symptoms. But if anybody wants to get a free test, you can sign up for our newsletter on our website, and you'll be registered for the drawing to get a free test to measure these.
Yeah, which a lot of regular doctors don't do, so you need to get that step done first. Thank you, Dr. Hansen.
Thank you.
It's a big topic. So if you'd like more information on what we just talked about, of course, you can see Dr. Hansen by going to drhansen.com. There's his phone number right there on your screen. Give him a call today.